Today we are doing filler kind of all over the face. So it's going to be very exciting and our patient's going to look even more beautiful. But what we're going to start with are her cheeks. Cheeks are so important and people don't even think about the cheeks. Or we haven't thought about the cheeks until, I don't know, maybe about 10 years ago. And we started realizing that once you lift the cheeks, then your nasolabial folds come up. Then all of this comes up and it really makes a big difference. So we want to start with the scaffolding before we start laying the bricks. So I'm going to show you what I mean with our patient today. So are you all ready?
I'm ready.
Okay, I'm going to have you turn a little. There we go. So we are going to go ahead and start. I'm going to go ahead and start right up here. Ready? 1, 2, 3. Da, da, da. And we just need to find her bone. There we go. And I love this particular filler. It's called Voluma. It's made of hyaluronic acid. And that is what we have in our skin to begin with. We just lose it over time. We don't really make it as much, I should say. Okay, so we're gonna just kind of travel. 1, 2, 3. You're so strong, good girl. I like it. Typically, people usually need about a syringe per side. And sometimes we need a little bit more on one side than the other. 1, 2, 3, depending on what side you sleep on, etc. You doing okay?
Mm-hmm. I sleep on my left side, so.
Do you? Okay. And then
most of the time, yeah.
Then you got the driver's side window that also impacts that left side. So try. I always freak myself out when I find myself sleeping on my left side. Like, no, the driver's side window. I gotta go over to the right, quick. Okay, so let's see. Nice. So we're gonna keep on going right here. 1, 2, 3. And there is some lidocaine in the fillers. You okay?
Mm-hmm.
So your face could feel a little numb.
Numb?
Yeah. But
The ice, I think, helps a ton.
the ice,
Yeah.
yes. Prior, yeah. I'm gonna do one more right here. 1, 2, 3, la la la. Okay, and we're gonna let that, yeah, nice. Nice. Oh, that's so cute. Okay, so what you're gonna do is, yeah, ice that side, and then I'm gonna give you an ice just to hold on this side for a minute.
Okay.
Alright, so we're gonna come over here now. Ready? 1, 2, 3, ooh la la. Right here, you okay here?
Mm-hmm.
So this side's not as depleted as the other side. But you're doing great. And now I think we're just gonna go a little higher over here. 1, 2, 3, up here high. You okay there?
Mm-hmm.
Awesome. Okay. That looks super pretty. One more spot down low. 1, 2, 3. Hoo-hoo. Okay. Nice. Okay, so now we're back on this side. 1, 2, 3. I'm gonna do a little bit more over here. And on average, like I said, people use 1 syringe per side. Sometimes you need to do a little bit more,
Mm-hmm.
especially on the sides that we sleep on.
Mm-hmm.
The thing I really like about this particular filler is that it can last you for 2 whole years.
Really?
Yeah. So
Wow.
it's nice that way.
That is amazing.
Now, if you do filler and you go, yeah, I look okay,
Yeah.
that's not what's going to last the 2 years. When you do the filler to correction,
Mm-hmm.
and you're like, I look amazing, that's what's going to last the 2 years.
Yeah.
Keep going here. Let's do a little bit down here. You okay?
Mm-hmm.
Does it hurt?
Does it hurt?
Yeah.
No, not really.
Feels funny. Does it feel weird to you? It always feels weird to me when
Well, I can, the little poke, the first little poke, I
Mhm.
can tell, but it's not, when something hurts enough, you wince,
Yeah.
it doesn't hurt enough to make me wince.
Oh. So now we are done with our cheeks for now, and I'm going to go ahead and do a little bit of an injection of lidocaine, and we're going to do our nasolabial folds, marionettes, and then we'll move over to our lips. So I'm going to put a little lidocaine right here. 1, 2, 3. Ooh la la. I know it buzzes so much. Good job. And let's do it right here. 1, 2, 3. Good job. So the reason to do that is because I like to use what's called a cannula. And so that's a blunt tip. So it's not a needle like we did up here.
Right.
But it's a blunt tip so I can go
up,
sure. Down,
feed
over.
it in and out.
Yes,
I got it.
exactly.
Okay.
And the reason I like it is for a couple reasons. When I want to do a bunch of different areas, like here and go across, then it's just one spot.
Right.
The other thing is because it's a blunt tip, as I glide through your skin, I say glide loosely,
Yes.
it irritates a bunch of the fibroblasts that make collagen. So you're actually making collagen as you're doing that.
Oh, cool.
So it's a great little tool.
Right, exactly.
Okay, you're gonna hold here.
Okay.
So I am going to just wipe again. Can you feel here? Okay, beautiful. 1, 2, 3. So that's just a little extra. That's how I'm going to get into your skin, because if I have a blunt tip, I can't actually get into your skin with the cannula. But now that I made my little channel, I can. So I'm going to go in through my little channel right there, and we're going to traipse up, 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 up. Here we go. See, I'm right there. Now let's do a little filler along here. So I'm going to go back into my same spot. Let's see, here he is. And then I'm going to just travel downwards now. So this is a great way to decrease the risk of bruising, because if I run into a vessel, it's going to push the vessel aside as opposed to piercing the vessel. Although it feels like a needle, it's not. So if people have an event coming up and they come in, 2 days before whatever event, and I'm like, oh my gosh, I can't believe you're making me do filler on you when you have an event in 2 days, I will use the cannula. This area loves to bruise too, so that's why I like doing filler with the cannula down for this spot. And I can still bruise you, but it's a lot less likely when you do. See how nice that looks? That looks great. You can't see.
I'm beautiful.
Yeah, beautiful. Yeah. So we're gonna go to
beautiful.
the other side now. All right, so we're gonna go right here, into there, into here. We're gonna go up into there, right along. So we're gonna go down there and just do that. I'm gonna get into this little commissure. Let's see, what do we think? That looks great. So I'm going to use my same little spot here, my little channel, and we're going to go across. This is going to feel a little funky, as it all does. Okay, and here we go. Here's a little filler right in here. There we go. Beautiful, beautiful. You okay? To this side now. This one is a little different filler. I like to use it when people don't have a lot of lip, because it'll give you structure. And the nice thing with this technique too is that it's safer for patients, because the biggest thing that patients worry about is bruising, but the biggest thing that injectors worry about is injecting into a vessel. You really can't with a this size. We'll just do this size cannula. Okay, we're gonna go the other side for a sec. And remember, they're gonna be a little nummy because this also has lidocaine in it.
Right.
How cute! You have little lips now.
That's a good
I know
thing.
they're gonna feel real big because I've just in there a bunch of times, and they're gonna get a little swollen. I'll smooth it all out in a sec.
That's okay.
We're continuing around the lips. This filler is specific for perioral lip lines, and again, I'm gonna use my little channel. Okay, now we're gonna go up a little so you can see where my cannula is up here, and we're just gonna go across. I love doing filler across lip lines, because if you go into each individual line, you're gonna get ducky. And that's the last thing people want to do, is to get ducky. Now look at how great that is. Aww. Okay, so let's go the other side. I'm gonna go up here. You got it. That looks really pretty. It's just really, this is a really nice soft filler. It's called Voluma. The one we used before is called Ultra. So they're not really for anybody to really ask for by name. You just kind of want to go into an injector that knows. So if somebody was to come to me and tell me to put Voluma in their lips, I would say no, because Voluma is for the cheeks. Or if they wanted Volbella in their cheeks, I would say no, because that's for their lips. But that's not for you to have to figure out. That's for your injector to know. And if they've been doing it for any period of time, they should know the differences. All right, come in. So it's just, like we said, and you can use this in the lips too. But I'm trying to, I like this one spot right here to try to continue to get with this. There we go. Okay, how you doing? Feeling full? Yeah, it does feel funny, right?
Yeah.
But it looks really nice. Like
Yeah.
your lip lines are amazing now.
Yeah.
So chin down, turn to me. I'm gonna go in through my same spot where I was before. I'm gonna come up. I'm just gonna lay a little thread right underneath of where we were, just to make that a little less shelfy. See, I love the cannula. You can go anywhere with this thing, and it's great. So this is always a popular spot that gets volume deficient here. Okay, let's see. Nice. So if you want to find out if filler or any of the 55 procedures that we do is right for you, come and find us at RejuvenationMD.medspa.com.